Hi, everyone. Today I have Ashley T on the podcast, and she is from Michigan. She literally lives probably 10 minutes from my house, and we have been chatting over email, but have never met in person, even though we are so close. She is going to share her endo journey with us today. Ashley, thank you so much for being on the podcast. Welcome. Why don't you tell us a little bit about yourself?
Yeah, thanks for having me. So my name is Ashley. I'm 33. Like you said, I live in Michigan, not far from you. I live with my husband and our corgi and our cat.
I love
Yes,
corgis.
he is a lot of fun. His name is Gus. Lots of energy. And yeah, I work as a nurse at a primary care clinic. And yeah, that's about
Okay.
it. That's
Yeah.
me.
Thank you for coming on. And I like cats too. Sorry to get really excited
That's
about the
okay.
corgi, but something about those short legs. I
Yes,
love how they walk.
I understand. He's cute. Yep.
They're so fun. They're so cute. Well, you and I have emailed back and forth a little bit, and you definitely have been on a journey here over the past several years. So take
Yep.
us from the beginning. Like, did you have painful periods when you were younger or when you started your period? Or, how were your early years, like teen years?
So I started my period when I was 11. It wasn't painful at first. It was fine for, I'd say, until high school. And then I started having pelvic pain, which I thought was normal. In high school, too, I started having GI symptoms. Um, didn't really look too much into it.
What
The
kind of GI symptoms were you having? Like stomach aches,
mo-
constipation, bloating?
Mostly diarrhea, honestly.
Okay, so the
Yeah,
opposite. Yeah.
yes, yeah, it was bad. It was worse on my period, but it would happen throughout the month as well, like to the point where I'd be like calling my mom from the bathroom stall to come pick me up from school.
Yeah.
Like so it was it was rough.
And were you just like, this is just something I have? Like, I just have diarrhea a lot.
Yeah, so I did end up going to a primary care doctor after maybe a year or two of that.
Okay.
They did stool studies. Everything was normal. They're like, you must have IBS.
Of
So,
course. How old were
yep.
you when you received that diagnosis?
I was probably like 17 or 18. Yeah,
Yeah,
probably
young.
17.
Young
Yeah.
for an IBS diagnosis. I mean,
Yes.
again, I'm not a medical professional, but that
Yeah.
seems like a young age to just be
Yep.
throwing out an IBS.
Exactly. Yeah. I mean, they didn't really know what else to call it. So,
Yep, I
uh,
know it's the
yeah.
fallback. I know.
And then, yeah, with the pelvic pain on my periods, I told my mom, she had me go to the GYN for the first time, and they put me on the pill when I was like 16.
And the pelvic, was it cramps or like what was the pain like? Was it on
Yeah.
your cycle? Was it off your cycle?
Yeah. At that point, it was just on my cycle, and I'd call it cramping. And it was there, but it wasn't like, I wasn't missing school. I wasn't like crying, but I was like, this is uncomfortable. I'd rather this not be happening.
Of
So they're like,
course.
let's try you on the pill, see if that helps. And it did.
Okay, so the pill, you went on the pill at like 16,
Yeah.
and that helped alleviate the symptoms a bit.
Yep. Yeah.
On
So
your
I could,
cycle, where you still have pain, but it was just reduced?
yeah, I would still have a little pain, but it was much better. It was tolerable.
Okay.
Didn't help the bowel symptoms at all, but
No. Yeah. Okay. So then you get on the pill, you're kind of just going day by day. What happens after that?
so I stayed on the pill for about 14 years.
Mm-hmm.
I tried a couple different pills throughout that time, but it was pretty well controlled. I'd say until like my mid 20s, late 20s. Um, and then the pain started getting worse. Mid 20s too, I started having like bladder symptoms. So it would always feel like I had a UTI. Would go in, they would test my urine, it'd be negative, and that happened many times, which was super frustrating.
Were the bladder
Um,
symptoms like pressure, like
yes,
burning,
it
pressure,
wasn't so much burning, but like pressure. So pressure and frequency. So I'd go to the bathroom,
and nothing?
literally get up, and I'd feel like I have to go again. I'm like, this isn't normal.
Yeah. Yeah. And were you still having bowel symptoms as well at this time?
Yep, yep.
Yeah.
So the bowel symptoms never went away.
Right. So bowel, bladder, your pain's better because you're
Yeah,
taking birth control.
yep.
But are you just like this? Like, I'm in my 20s. What is going on?
Exactly. Yeah. So, and over the years, like, it's slowly, things started getting worse.
Yeah.
Um, and then like late 20s, the pain on my period started getting really intense. Um, and I had a couple friends that had IUDs that stopped their periods. And so I'm like, okay, well, if I can stop my period, stop the pain, that makes sense. Let's get an IUD.
And at
So
this point, like, you've never heard the word endometriosis. You think that this pelvic pain is normal.
yeah, so I had heard of endometriosis.
Okay.
Not, it was never brought up to me personally. Like, hey, we think you have endometriosis.
Sure.
But I had heard of it. I actually, like, when my period started getting worse, I had looked it up on my own,
Yeah.
and I read a few things, and I'm like, no, that can't be me. My pain would be worse. Like, I must just be a baby. Like, this is how everyone feels. It's fine. I can't have that.
Yeah. Yeah.
Um,
I completely I understand that. Okay.
yep.
So the IUD.
Yes. So I got the IUD, went in, told them what my symptoms were. Nobody really asked any more questions. They just said, okay, sure, you had painful periods. Let's do this.
Right. And was it a hormonal or non-hormonal?
It was hormonal. So it was
Okay.
the Marina.
Okay. Yep.
And it helped. I had it helped for a little over a year and a half.
Okay.
Periods went away. So that was great. But yeah, about a little over a year and a half. Then I started having the pain again. Wasn't having periods, but started having like abdominal and like pelvic pain.
Okay.
Didn't realize it was kind of cyclical, but eventually it led me to the ER.
Yeah. Yeah.
So
you were doubled over and something's
yeah.
wrong.
Yep. So it was like 24 hours of pain, and I'm like, okay, this isn't getting better.
Sure.
It was on like my right lower side, so I was worried it might be my appendix.
Understood.
So I went in for that. They didn't do a pelvic exam, but they did a CT scan. Wasn't my appendix, and they found I had an enlarged left ovary and an enlarged left kidney, cyst on my kidney, and that was it.
And so what was the treatment plan with all of that afterwards?
So they said to follow up with urology for the enlarged kidney, and then follow up with a gynecologist.
And this is still in your late 20s?
So this,
or now are you in your early 30s?
At this point, I'm probably 30, maybe 31.
Okay.
31. Yeah, 31, because it was 2019.
And were you just like, okay, this is weird, I'll get it checked out?
Yeah, exactly. And it also was weird because they were, they found things on the left side, and I'm like, but that's not where my pain is. My pain is on the right side, but okay, I'll look into this because what is going on?
Yeah.
So saw many gynecologists after that.
Yeah.
They ordered an ultrasound. And that first ultrasound that came back showed all sorts of craziness happening in my pelvic area. So there was
like fluid. It probably showed like free fluid in the pelvis. And do you remember how big the cyst was?
So they couldn't quite tell because they kept calling it like a mass. So they said it could be less likely an endometrioma. There was like a tubular structure. There was hematosalpinx, which is like bleeding in the fallopian tube.
Yeah.
And then it just said there was like a mass on that left like tube ovary area, so that it wasn't like clear definitions of each structure.
Okay.
And then there also ended up being a cyst on my right ovary as well. That was smaller. That was only like 2.5 centimeters.
Okay. So at this point, you're on an IUD, so they're not really going to offer you anything else. What was the plan? To watch and wait?
Well, they gave me the option. So she said we could add on a birth control pill, or we could just do a repeat ultrasound in 6 weeks and see if it resolved on its own. Okay. She did mention possible endometriosis at that point. So that was the first time I heard that. She said she didn't think that was what was happening, but maybe. And I was like, I don't want to go on the pill in addition to the IUD. That's just too many hormones.
Yes.
That seems, I'm like, if we don't even know what's going on, like, I don't want to do that. So like, let's just wait and see.
Yeah. Yeah.
And in the meantime too, I saw the urologist. Okay. For that hydronephrosis, that enlarged kidney. And they said similar things. So we're going to order more tests. They want to do a kidney function test to see if that kidney function was affected, and then kind of make a plan from there.
But at this time, are you having any inkling that like all of this is related, or does it just feel like separate issues?
So they thought, based on that first CT scan, they thought that left ovary mass was pushing on that ureter possibly, which was
Blocking
causing,
it.
yeah, exactly. So they're
Got
like, you know,
it.
if that cyst just goes away on its own, then maybe
You're going to be fine.
exactly. Then the hydronephrosis will resolve on its own. And they're like, you
Yeah.
know, you've never had a CT scan, so maybe you've had an enlarged kidney for years, and you know, we just didn't know it. So I'm like,
Were you having back
weird.
pain
Okay,
with the
it wasn't.
kidney?
Nope,
Interesting.
not at all. So
Right.
yeah, it was. I mean, I was having bladder symptoms, but no flank
Yeah.
pain. I never
You're
had.
still having
a kidney
diarrhea at
infection.
this point too?
Yep. That never
Yep.
went away.
Never went away. So you were
No.
the bladder urgency and the diarrhea just was consistent throughout this journey.
Yeah.
Okay.
Exactly. Yeah.
Okay, so you get all these tests, you're gonna watch and wait.
Yes.
What happens?
So at this point, the pain's getting worse. So instead of just being on my period, now it's like 20 days out of the month.
Yeah.
It's bad. So we do a repeat ultrasound. It shows similar things like 6 weeks later. I end up going to the ER again because the pain's getting worse. And then I'm worried about my kidney.
Sure.
But yeah, they're pretty much like, it's chronic at this point. You know, see your GYN. So then I see another gynecologist. He's like, okay, this is endo. He offered Orlissa, which at that point I had done some research on my own, and I'm like, I don't want Orlissa.
Yeah.
He also told me that was the first time. He said, since your tubes are effective or are affected by this, you're likely going to need IVF because it's already pretty invasive. And at this point, I'd never even started to try having children, so that
Sure.
was
Yeah, you're
devastating.
young. Yeah. Oh, I'm so sorry.
That's okay. That's part of it. So he refers me to another. So he gave me the option of Orlissa or possibly surgery. He's like, I don't do surgery. I'll refer you to another one.
Okay.
So I see that doctor. Turns out they scheduled me with the wrong doctor. I have to get rescheduled again. So it just keeps getting pushed back, like a month in each appointment.
And you're just in more pain and more pain.
Exactly.
And more pain. Yeah.
Yes. But finally, I get an MRI. I see their endo specialist.
Yeah. Yep.
He, you know, says that I do need surgery. We're going to have urology involved. We talked about colorectal being involved, but based on the MRI, he didn't think it had gone through my rectum. So he thought he could just kind of like shave off the top.
Okay.
He did do excision.
Okay.
So that was some good.
Yes.
Yeah, so we planned for surgery. So that was like September was when I saw him the first time.
Okay. September of 2019?
2019, yeah.
Okay.
And then what was going on? So they're also keeping an eye on my kidney throughout this process.
Yeah. Was he saying at this point, like, we think the kidney is affected because of endo? Like, now you know it's all connected. Okay.
Exactly. Yeah. Okay. Based on that MRI, they could tell more so that mass was pushing on that ureter and compressing it. So it was narrowed. And then so they do another kidney scan. That left kidney got down to like 12% function. Wow. So yeah, they decided to put a stent in before surgery because they couldn't get surgery scheduled yet with both doctors, which was frustrating. Yes. So another procedure.
Yes.
So yeah, they put the ureter stent in, which if anyone has had those, I'm sorry.
Yes.
But that does buy some time so that kidney won't worsen while we're waiting on surgery.
Right. And are you having any back pain or anything yet with the kidney? No.
So, well, after the stent was put in, the stent symptoms are also similar to like that of a UTI. So at that point, it was worsening bladder symptoms all the time. But again, I knew it was the stent, so it wasn't worrisome. It was just really a lot on top of the endo pain.
Well, and for people who are listening and you don't know what a stent is, and Ashley is a nurse, so she can probably define it better, but I've only had stents in during the procedure, but nothing left behind. But basically what it does is it it opens up your ureter. So whatever, there's free flow, so there's no blockage, right? It's almost like
Exactly. Yep.
a bridge
Yeah. Just keeps it open, keeps it patent so
flowing.
that the urine can flow. Exactly.
Yeah, exactly. Okay. So you get the stint, then what happens? Obviously that was probably very painful.
Yeah. So they put me under when they put it in. So
Oh,
that was,
okay.
I was,
Good.
yeah. Yeah. That was the first time I had anesthesia actually.
Oh my
So that wasn't
goodness.
bad. It was just the after.
Yeah.
And then they scheduled surgery for December at that, somewhere around there. So I had my plan. I went and met with a reproductive endocrinologist at this point because I don't know if I mentioned that endo doctor had also said I'm probably going to need IVF. The surgical plan was to remove my left ovary, left fallopian tube.
Okay.
Because that mass was just like everything was connected and it was going to be too messy. Yeah.
Yeah.
And then I had an endometrioma on my right ovary as well. So he's like, that ovary could be damaged during surgery. So if you can do IVF, if you can freeze your eggs, that's recommended.
Okay.
So I did.
Okay.
And
how does that process work? I've never done that, and I know that endo patients sometimes do this. So how do they do that? Take them out during the surgery, or let us know how that works.
Unfortunately, no. It was another separate procedure.
Do you have to go under anesthesia for that as well?
Yeah. Yep. I actually had to have a cyst drain during that too. So it was interesting, but it's 2 weeks of medication. So the daily hormone injections, like 3 or 4 times a day. So injections in your belly. It wasn't pleasant, but it was tolerable. I thought it was going to make my symptoms worse. And I don't want to say it made it like very, very bad, but it was not as bad as I thought as far as endo symptoms.
Do you still have the IUD in at this point, or did they take it out?
Oh, yeah, I missed that. So back in August, when they scheduled me with the wrong doctor, he did remove the IUD because he's like, your symptoms started after the IUD was put in. Let's take it out and see if it helps. Things got worse after the IUD was out.
Yeah.
Because my period came back and it was
angry.
Yes.
Yes. It was angry. It was like, here I come. I'm coming back to tell you.
Absolutely. Yes. I'm here. Yes.
I just wanted to let you know that I'm here. Okay. Yeah. So you have eggs frozen. And what month is this now? So all of this has happened. How are you feeling like mentally during all of this? It's just so much happening at one time.
Yeah, it was a lot because this is all happening in like 1 year. So this is all 2019.
Yeah.
And it's just constantly one thing after the other. So it was like mentally, I was just drained. Physically, I was drained. It was a lot. My husband was amazing throughout all of this. Thankfully, he was very supportive. So that was helpful.
Something that I don't feel like I talk about enough on here, but I was just talking with some other patients yesterday, like just the time scheduling appointments, making appointments, talking to the office staff. Yeah. Sometimes the office staff, and I hate to say this, but at doctor's offices are super rude, and you're like at your breaking point because you're just trying to get help. And that's just such a huge part of it that I feel like is never talked about it. And the financial aspect. I mean, all of that on top of not feeling well, it's a lot.
It is. It really is. There's so many different aspects of it that just make everything worse.
It just intensified, right? Like it's just, every day it's just kind of like, what little step can I take today? And, in a positive way, the way that I always try to look at it is like, okay, what 4 steps can I take today? And if I only get 3 of them done, well, I only call this office. I only call, that's okay.
That's okay.
Like,
do what you can.
Do your best. Yeah. Okay. So you have your eggs frozen. What month is that?
So this is December 2019. So
okay. And you're supposed to have surgery in December as well?
I was, but I called the office to ask like a pre-op question, and they're like, "Well, that's weird. You don't have surgery scheduled."
Oh no!
They had canceled the surgery. Didn't tell me because they couldn't coordinate the urologist that same date, but no one told me for over a month.
Oh my gosh!
That was. So
going back to doctors' offices and frustrating things. And
but we were able to get it rescheduled. I actually called the patient advocate. It was intense because I'm like, this is unacceptable.
Yeah.
But they got me rescheduled for, I think it was like 1 or 2 weeks later. So it wasn't too bad.
Okay.
Um,
But was it in January now?
Yes. So now it's in January. And so I ended up having it January 6th, and going into that surgery, the plan was they're going to do excision, remove the ovary, the fallopian tube, the endometrioma on the right side, and then they were going to actually cut out a piece of my ureter and reattach it to a different spot in my bladder. If that didn't work, I had signed a consent for them to remove that kidney. So that was like a last case or worst case scenario. But yeah, going into that, it was scary.
Wow. Yeah.
But thankfully, surgery
huge.
Yes. But surgery went better than expected from a urology standpoint. So they didn't have to do that. They actually didn't have to cut it. They were able to just, once they removed that mass and that ovary and that tube, that helped. They actually excised and burned some of the endo off that ureter. And then the urine was able to flow through. So they didn't have to cut anything out. So that was
goodness. Good. Yeah.
And yeah, so that was in January. A couple weeks later, my bowel symptoms got worse. And so
did they say anything in your follow-up about the bowel?
They did. So I had reached out to my surgeon because I'm like, I was having rectal pain just on my period before the surgery, but now it's 2 weeks after. I haven't had a cycle yet, and I'm having severe rectal pain daily, like a pressure in my rectum.
Yeah.
I was going to the bathroom like 20 to 30 times a day. It was,
oh my goodness.
It was awful. So he's like, give it some time. We'll see if it gets better. It didn't. So then he referred me to a colorectal surgeon.
Did you have before you go into the colorectal, did you have a follow-up appointment with him? Did he say like, you have stage X, like this is where we found it, we sent it to pathology?
Yep. So I had stage 4. He found it everywhere. I had obliterated cul-de-sac. He did. He did.
Took the ovary in the tube?
He did. Yep.
Okay.
So he took both on the left side. He actually drained the endometrioma on the right ovary.
Okay.
Which is good because it helps. I mean, you're less likely to damage that ovary, but bad because it's more likely to return.
The cyst wall is still there. Yeah.
Exactly.
Yeah. Okay. So that was your follow-up. So now you're having these bowel symptoms and pain.
Yes.
Okay. So you call the colorectal surgeon.
Yep.
Or doctor.
Yep. Well, he was a surgeon.
Surgeon. Okay.
So I go in, I see him. He tells me I'm not a surgical case, and that he thinks I have pelvic floor dysfunction, which I agree with, but it's more than that.
Yeah.
But he did order a colonoscopy.
Okay.
So that was one good thing from that visit.
Yeah.
So I have that eventually in June, that colonoscopy, but they weren't able to complete it because the scope couldn't fit. Yeah, it went in some, but they couldn't pass a certain spot because it was too narrow. There was like a mass. They called it like an infiltrative, bulky mass pushing on it.
AKA endometriosis.
Yes, exactly. So that was.
So did the previous doctor just not see that when he was in there, or not feel that he had the right skill set to take care of that?
He thought that he knew he had left some, but he thought he had taken enough that it would improve my symptoms.
Got it.
So he, even after my post-op appointment, he did an exam. He said he could still feel some, but he really thought he had taken, like, debulked it enough that it would help me. But unfortunately, that was not the case.
So January to June, like are you still just having these bowel symptoms for this whole time before that colonoscopy? How are you feeling otherwise? Like, how's your recovery? How's your cycle?
My cycle, not good. Honestly, my daily pelvic pain, daily pelvic pain got better for a couple months. But my cycles were never good. I was calling out sick from work the first day and the day before every month. Literally like screaming, crying, crawling. He did prescribe Norco for my cycles, just to take like a half tab
Sure.
on the like first and second
So you
day,
can
because I
make
was
it
like, I
through.
can't function.
Yeah.
Yeah.
All right. So after the
Yeah.
colonoscopy, they can't perform it. Now what happens?
So then my gynecologist calls me, tells me he saw the results of that, and he's like, "Yeah, that's endo. You're gonna need a bowel resection. I'm sorry. Most likely you might need an ileostomy, but it would be temporary. Um, so that's he's like, you're gonna have to talk to colorectal and get that scheduled." So
Okay.
finally talked to that colorectal surgeon, which took forever to reach him. And I talked to him on the phone, and he just did not make me feel comfortable. He said the plan was going to be definitely an ileostomy. He didn't really have experience with endo, mostly colorectal surgery. Mostly cancer surgery. And so it's just not the same.
Yeah.
I'm sure you're a skilled surgeon with that, but it's not. It's not the same. Endo presents differently.
Yep.
So I actually had scheduled surgery with them. In the meantime, had a second and third opinion by 2 different Nook surgeons.
Good.
And went with one of those.
Good. Good.
Yes. So I actually went with Dr. King at the Cleveland Clinic. Highly recommend her.
Okay.
She works with a colorectal surgeon, so they have like a team approach. He's very skilled with endo as well. So she was amazing from the first phone call, because she's in Ohio. I'm in Michigan, so like a 3-hour drive. But she was amazing. Like when I talked to her on the phone the first time, she's like, "You've come to the right place. We do this all day, every day." I was like, "Thank you."
Yes, that's so good to hear. Yeah, because in Michigan, for people listening, we only have one doctor, but that is at least skilled, but he's been on medical leave for a really, really long time.
Yeah.
So people are really struggling. So it's nice to hear that there's someone 3 hours away.
Yeah, definitely worth the drive.
Okay, good.
So went forward with surgery with Cleveland. That ended up happening in September
Of 2020.
Yep, of this past year. So 2020. That was quite the intense surgery. So it was like 8.5 hours. They did
Wow.
so she did excision again. She said endo was everywhere again. So I'm like, "Do you think it like grew back?" And she was like, "There's no way this grew back that quickly." So he removed some definitely, but there's still a lot there.
Yeah, and I think there's something to note there. Again, not a medical professional and always seek advice, but I just think some doctors think they think they've removed it or they've removed enough, but if they aren't a specialist or have the skill set, I just like I don't have the skill set to do accounting, right? Like I am a marketer. So like that's not my skill set. I could do a little bit, but it's not my expertise.
Right. And I think my first surgeon, he was skilled. I don't want to say he wasn't skilled, because he was, but he also took a more conservative approach. I really didn't want to have an ostomy. So he's like, "We'll do a more conservative approach," and turns out that wasn't
But I think it probably led you down the right path of finding this other doctor, right?
I mean, this could have been one surgery, definitely.
So. Yeah, well, that's for sure. Okay, so September, you have your surgery, 8 hours.
Yep. So they did a bowel resection and then a loop ileostomy. They removed 25 centimeters of my part of my colon and my rectum. In the hospital for like 8 days. It was
very hard.
Awful.
And during COVID, could you have visitors or no?
I could have one. So it had to be the same visitor every day, which is fine. So my husband was there, but then he also had to stay in Cleveland for longer than expected, because I had complications after I had an ileus. So my bowel didn't wake up after. So it was very unpleasant.
Yeah.
And also too, so they told me before I might have the ostomy, and I woke up with it, and I had prepared kind of, but really was hoping it wouldn't happen. So that was just very difficult, like mentally to deal with after.
For sure. I mean, 2 years almost, you've really had so many procedures. You went through so much in 2 years, essentially.
Yep. It was a lot. Oh, I also want to make a comment. I found this interesting, and which is why it's so important to get your medical records after and like your surgical report. They had commented that in my rectum, it had the consistency of concrete. So it's
In the
like,
first
wow, that's
surgery?
no, and this one. So this in
Oh,
this
the second
September
one.
surgery. Yeah. Um,
Wow.
so it's definitely interesting to read those, but
Yeah.
after they're like, I don't know how you were going to the bathroom. I was like,
I
I told you guys. Yes.
right. Yes. So
um,
you're in the hospital. I'm sure you have that, this isn't that long ago. So how's the recovery? How are things going after that?
recovery was rough after that.
Yeah.
Just because of the ostomy though. My daily like pelvic pain, once I wasn't having like the surgical pain, that was
Mhm.
much better. My periods were so much better. The first couple, I still had rectal pain, which I do want to mention this because I still had rectal pain and I was really scared that they had missed something. And I was like, oh my God, this is just going to be my life.
Yeah.
But after I want to say the first two, maybe the third one, the rectal pain had gotten, it was gone. So
So
if
maybe
that
there's just
happens
some
to you,
inflammation from the surgery or something pressing on nerves or who
yeah, it,
knows.
it was nerve. Yeah. So they're like, your body is so used to like having your nerves respond that way. Give it time and it
Yeah.
will get better. And it did. So now
Good.
my periods are so much better.
Oh my
I can go to work.
goodness.
I'll take like, one Tylenol or a couple ibuprofen like once that day. Just
Amazing.
function.
Yeah.
So that's
Yeah. I think
wonderful.
that's what it's supposed to be like.
Exactly. I'm like, I think this is what a normal person feels like on their period. Yeah, this is
Right.
this is good.
Right. Exactly. Okay.
Um, yeah. So that's me now. I did get my ileostomy reverse, so that was
Okay.
great too.
Did you have to go back to
Um,
Ohio to do that or
I
yeah.
did.
Yeah.
Yeah,
That's
I've been in
okay.
Ohio quite a bit.
Yeah.
But it's okay. It was worth it. They knew what they were doing.
Yeah.
So yeah, I had that reverse on New Year's Eve.
Okay.
So now I'm 7 weeks out from that.
Happy new, starting the new year off
Yeah,
right.
exactly. Different kind of celebration, but that's okay.
Good. Yeah. And so how are things going with the bowel now? Do you in your stomach and your bladder? Like how is everything? I know it's only been
Yeah.
7 weeks, so you're
Yeah.
still healing, but how are you overall feeling?
So with the bowel, it's still so after you have an ileostomy reversal, it takes, they said, 6 to 12 months for your body to get back to normal. I don't
Yeah.
know what my normal will be,
Sure.
but it's still better. So I still have to go to the bathroom frequently,
Yeah.
but not 20, 30 times a
Yeah.
day.
Yeah.
And it's not painful. It's not painful at all.
Good.
So it's very tolerable.
Good. And you're like,
Yeah.
you feel like you can eat. I mean, do you have to be on a special diet right now as things are adjusting, like a low fiber diet?
Exactly. Yeah. So after they said 4 to 6 weeks, the low fiber, like softer foods. So I'm at 7 weeks, but honestly,
Okay.
I'm afraid.
I
I'm
understand.
slowly
Yeah.
introducing things, but I'm
Sure.
just so scared because I'm still at risk for an obstruction. And that
Yeah.
pain, it's not
Yeah.
something you want to do.
No,
So
it's
taking
not.
it easy.
Yeah, good. Well, I'm so happy to hear that you're feeling better and you look amazing. I mean, you look very good
Oh,
color
thank
in your
you.
cheeks and everything. So, for if anyone wants to watch this on YouTube, I forget to plug, but I do put the videos on YouTube of us chatting. But if you're listening, Ashley has good color in her cheeks after all those
Thank you.
procedures. So, as a nurse, do you
Mhm.
feel like, gosh, like how I know several nurses actually with endo that just look back and they're like, how did I not know about this? I
Yeah.
work in the
How did I
medical
Exactly. How
field.
did I just accept this and just like, yeah, exactly. Especially because I had heard of endo. And again, like I had looked it up. I
Sure.
just thought it would be worse. Like
Yeah.
and I think we underestimate our bodies and we're just like, this is normal. Like I'm
Yeah.
just being a baby. This pain, everybody feels a similar pain to this and I just can't tolerate it.
Yeah.
That's not the case. So, um, yeah, definitely listen to your body.
Yeah.
I will say, like, being a patient instead of a nurse has been interesting. It's just really frustrating, the
Yeah.
healthcare system. So many things, like, doctors not calling back for weeks or, surgeries being canceled and not
Yeah.
notifying the patient. It's just crazy. And it definitely makes me more empathetic to patients. Like I would never want this to happen to someone. So I feel like it's made me be a better nurse, honestly.
Yeah, for sure. I mean, I think it's made me just a more empathetic person in general.
Yeah.
And that's why I do get frustrated sometimes when people are rude at doctors' offices. I want to be like, do you know like how much energy it took me just to pick up this phone? I've been on 12 calls already today trying to get help, so I think that's such a big point. Well, thank you so much for sharing all of that with
No
us.
problem.
Really appreciate it. Is there anything, any tips or any advice that you want to give everybody who's listening? I always ask this because I think there's so many great tips that can help people get through everything.
I would say too, I don't think I even mentioned this, pelvic floor physical therapy. I started that after my September surgery, and I think that has helped as well. So I would recommend that. I know everybody already uses a heating pad, but if you buy the Thermacare extra large ones for your back, flip it around, it's a bigger surface area.
Yes.
Highly recommend that. What else? Support groups online I found helpful.
Yeah.
Obviously, Nancy's Nook, I know you've mentioned that, but just finding the right.
Yeah. Or local, sometimes local, there's some local ones that have meetups. I mean, outside of COVID, I agree with you. Having a community is very helpful. Yeah.
Yeah. Because I mean, your friends and family try and they're definitely supportive, but to talk to people that have gone through something similar helps. And even like with the ileostomy, that was really hard for me mentally. I didn't know anyone that personally had one, so I found a couple girls on Instagram and chatted with them, and that was helpful.
Good. That's a great tip, though. I mean, it really does help to talk to someone who's been through it, and you can ask them advice.
Exactly. Yeah.
Yeah.
What else was I going to mention? Yes, like I said before, getting your records, because I don't think I mentioned this either. That first gynecologist I saw after my first ER visit, when I looked at her documentation, she had put in my record she thought she felt an endo spot and didn't tell me. So, read your records because you might find out things about yourself.
You know what I do now is I have like a full binder. I'm literally the person, like I should probably scan it all and put it in like a Google Doc, but I literally have like this, and then I'm just like walking around with my binder because
you have to.
I agree with you. I had a surgery with a doctor that swore up and down that they did excision, and then I read the operative report and they didn't.
Yeah. Oh, that's so frustrating.
I was just like, this was years later, I didn't read it like right after. And then years later, when I knew what excision was, I was like, oh my goodness, this doctor didn't do excision. So I agree with you. Reading them. And if you have questions about them, asking your doctor is, or
absolutely.
You can always go to trusty Google too, and just kind of see what they mean. Yeah. But I mean, definitely talking to your medical professional and say like, what was this? What did this mean? Like,
why did you do this?
Tell me this. Like, yeah, for sure. Well, thank you so much for coming on. Is there anything else you want to share before we go?
I don't think so. I think that's it. I appreciate you having me on here.
Oh, thank you so much for coming on and being so brave to share your story. And you've been through a lot, but it sounds like you are on the next path to
I hope so. Yeah. Hopefully hopefully it'll be smooth sailing, at least for a little while.
Yes, it will be. It will be. Great. Well, thank you so much, Ashley.
Thank you.